Good afternoon. I am Teresa Toll. I am the current APHA president, and also I own an independent pharmacy in Sebastian, Florida. We are excited to welcome you to the inaugural session of APHA's new Open Forum series, designed to help you keep a pulse on timely practice and policy topics that impact the profession. As the voice of pharmacy, we wanted to create a platform for you to come together and be informed, be heard, and engaged with opportunities to make an impact. This series is going to take place on the second Thursday each month, and we hope that you will continue to join us. Today's Open Forum will focus specifically on advocacy efforts to gain payment for pharmacist patient care services. And I think you're going to be excited about our panel. We're going to discuss the latest that the federal provider status legislation means for pharmacists, how this policy can help expand access to pharmacist services and address gaps in health equity, examine legislative successes in states, and talk about the ACT Pharmacy Collaborative Advocacy Program. So now I get to welcome our speakers. Our first will be Melissa Soma-McGivney. She's the Director of Academia CPSN Transformation, which stands for, or the acronym is ACT, Pharmacy Collaborative, which is a nationwide collaboration to support and facilitate community pharmacy practice transformation efforts. She's also the Associate Dean for Community Partnerships and Professor of Pharmacy and Therapeutics at the University of Pittsburgh School of Pharmacy. She's committed to advancing pharmacist-provided patient care in the community and has demonstrated this as a founding member of the Pennsylvania Pharmacist Care Network. And through the direction she provides to the Pitt Pharmacy Community Leadership and Innovative and Practice Center. Welcome, Melissa. Next, we have Elisa Bernstein. Elisa is APHA's interim executive vice president and CEO. For the past 2.5 years, she served as APHA's senior vice president of pharmacy practice and government affairs, leading the association's advocacy and pharmacy practice efforts. Prior to coming to APHA, she spent over 30 years advocating for pharmacy and patients at FDA, where she held several senior leadership positions, primarily focusing on drug regulation, compliance enforcement, and pharmacy affairs. Welcome, Elisa.
Thank you.
And Michael Murphy. He is our advisor for state government affairs at the American Pharmacists Association and an assistant professor of clinical pharmacy at Ohio State University, the Ohio State University College of Pharmacy. In these roles, he teaches, conducts research, and advocates across the country for increased patient access to pharmacist-provided care. He previously was part of a team working at the Ohio Pharmacists Association on the implementation of pharmacist provider status legislation in Ohio. He's held several volunteer leadership positions, including his term as the 2017-18 APHA ASP National President and member of the APHA Board of Trustees. Welcome, Michael. So this is our format for today. We're going to have discussion with all three of our guests. And then after we do some Q&A with them, we will be asking you to share your insights. So we'll have open forum. And in addition to questions, we also are going to ask if you want to share some thoughts or experiences that you've had. And then finally, as a wrap up today, we're going to tell you more about what APHA has been doing and learn about ways that you can engage more with APHA in our advocacy efforts. So these are our ground rules for today. In your panel on the side, you have a questions field. So we encourage you throughout the Q&A today to submit questions or comments. And at the after we do our Q&A, then we will come to those and try to get to as many as possible. There's also a handout in the GoToWebinar toolbar that you can access that will provide more resources for you. And afterward today, there will be a recording of this webinar that will be made available for members only. So with that, we are going to move to questions and answers. And Elisa, I am going to start with you for an overview of provider status. So can you tell us how APHA approaches provider status at the federal level?
Yes, thank you. And yeah, and if we can move to the next slide. So provider status has been kind of that eye on the prize that we've had in the profession for many years. And that's why we're having this, to really kind of flesh out and talk about at the federal level what we're doing. But you can't really talk about the federal level without looking at all of the other places that we have efforts across the profession to secure patient access to and coverage for pharmacist patient care services, because oftentimes it all interacts. So at the federal level, the legislation is often limited to what is allowed at the state level through state scope of practice. So those are really important and go hand in hand. CMS and addressing the issue. So we're focusing not just in the US Congress, we're focusing on all the states as well. And then CMS is also a really important player here, because when it comes to Medicare and Medicaid, they're the ones that set the policies. So we need to really put a lot of focus on CMS and the partnerships there with our profession in terms of educating and advocating. And then on the commercial side, the commercial payers who within that scope of practices are taking those opportunities and paying for pharmacist services. And so all of this kind of works its way together, it's overlapping, and you can't talk about provider status per se without looking at all of these as a whole.
Very good, thank you. It is extremely complicated. So then specifically, can you talk about what is happening at the federal level right now with we have two provider status bills. So can you explain to us what's in them and maybe help compare or contrast the bills for us?
Yeah,
and what it
sure.
will mean if the legislation passes.
Yeah, and I want to step back for a moment, because I think it's important to really just focus on, so what is provider status? Why is it called provider status? Because it's really just a term of art when you're talking about it specifically at the federal level, because it's pharmacists becoming eligible providers in Medicare Part B for Medicare beneficiaries. And in order to do that, all of the other providers who provide care are listed in a specific section of the Social Security Act. And so what we want to do is insert pharmacists and the pharmacist services that we provide into that law. And it's this, Section 1861S of the Social Security Act. You don't need to remember that, but that's exactly where this would be put from a legal perspective. And then, so what is Congress doing, and what do we have? If we can go to the next slide. Right now, there are two bills in the US Congress in different places and different parts that address that provider status of putting pharmacists as eligible providers for Medicare Part B beneficiaries. And the first one, which is where our focus is now, and it's called ECAPS, because you always have to have an acronym for legislation, and I'm not going to read it because it's right there in front of your screen. This was just introduced in March. I believe it was March, maybe it was early April, but in just a very shortly time ago, into the House, in the U.S. House of Representatives. And it does establish pharmacists as eligible providers, but only for certain services. And the idea here is that pharmacists have been front and center during the pandemic. We all know that. Others know that. Our patients know that. And we want Congress to incorporate into the law those services that we've been providing, so that after the temporary authorities go away, we can continue providing this for our patients. So what this ECAPS does is it focuses on test, treat, and immunize, providing the authority for pharmacists to test for COVID, flu, strep, and RSV, treat COVID, flu, and strep. And why not RSV? Because at the time there's no treatment per se for RSV, and immunize for COVID and flu. Again, at the time this is written, there's only vaccines for COVID and flu. So the test, treat, and immunize services, as well as creating an opportunity for the Secretary of HHS to turn on pharmacist services when there is a need in a future public health emergency, public health need, or to close gaps in health equity. And what's really important here is it's not just giving the authority for pharmacists to do this, it's creating that reimbursement mechanism, because we want to be able to do it, but we want to be able to get paid for it. So that's the important piece. And then, as I said before, it's limited by the state scope of practice. So that's why we need to fight in the states for the ability to do these things as well. And then so this is where our focus is now. This is the new legislation that was just introduced, as I said, and there's a lot of effort behind it, which I'll talk about in a moment. But let me just mention the other piece of legislation. It's a bill that is also in play that was introduced last year, the Pharmacy and Medically Underserved Areas Enhancement Act. You've heard us at APhA talking about this. If you've been on these webinars before or read any of the things that we put out, we were very excited when this was introduced, put a lot of effort behind it, and it establishes pharmacists as providers in Medicare Part B, focusing on medically underserved, any service limited to the state scope of practice, but only in those areas where Medicare patients are in medically underserved areas and there's a healthcare professional shortage. So this, what's really good about this is it opens the door for pharmacists to address the health equity issues in this country. And this bill was also introduced in the House, in the Senate, was bipartisan, but right now the focus is on the other bill, because even though health equity is an issue, right now there's more weight behind the other bill. And if you go to the next slide, I'll explain the reason for that. This is because there is actually a coalition across the pharmacy community behind really putting a lot of effort into passage of the ECAPs. And we are a founding member of the Future of Pharmacy Care Coalition, which is also comprised of ASHP, NACDS, McKesson, Amerisource, Cardinal, CVS, Walgreens, Kroger, and Abbott. And so we have been pushing on the getting more people, more stakeholders to get behind this, as well as getting more sponsors to be added to the legislation, and pushing to get it introduced in the Senate as well. And if you want some more information about that coalition, here is the webpage. And I will stop for now. I answered your question and with a lot of information, Teresa.
All right, great. Well, I am actually, I guess I could do this in the Q&A. This webinar series is really designed to be about opportunities to make an impact. So I'm going to come back to you in a bit and ask you why it's important for all of pharmacy to get involved in advocacy efforts. Okay, so chew on that question, Elisa, and we'll come back to you. But thank you for all that information. All right, so Michael, you're next. So we've heard a lot about federal provider status legislation. Can you tell us what's going on with provider status legislation in the states and how APhA approaches that?
Oh, yeah. Well, I should be able to wrap this up in about 3 hours. So all in jest. So there's a lot going on at the state level, and there's a lot of very exciting advancements. I'll start here by sharing a little bit about how APhA approaches state provider status legislation and getting pharmacists paid for their patient care services, and then we'll kind of talk a little bit about what we're observing across the states. So we work very closely with the state pharmacy associations and provide support to them as they are advocating for legislative and regulatory efforts to recognize pharmacists as providers within state law, and to support in the implementation of legislation and regulations that allow pharmacists to be recognized both by state Medicaid departments and commercial health insurance within the states that allows for the reimbursement of their patient care services. One of the big things that I really want to highlight here is that we're seeing a lot of this really focus on the reimbursement of services under the medical benefit. And that's one of the big common themes that we're seeing across the country, is that big focus on reimbursement under the medical benefits within Medicaid and commercial insurance. Other things that we do to really approach helping to support getting pharmacists paid for their services is working collaboratively with health plans. There are many health plans across the country that really understand the strong value proposition of pharmacists, and both when it comes to the positive therapeutic outcomes for pharmacist services and the really strong economic return on investment. But there needs to be someone in the middle that's really helping to connect pharmacists and the health plans to understand, how can we work together? How can we help to credential pharmacists? Where can these services actually happen? And that's really where APhA can serve to facilitate those conversations and help to support the implementation of programs where pharmacists can get paid for their services. On the next slide, you'll see in general a summary of what we're seeing across the state when it comes to pharmacists getting paid for their services. Now, I do want to highlight that this is not a comprehensive representation. This is meant to showcase examples of where pharmacists are being reimbursed for their services for a broad scope of their services. So this leaves out states where pharmacists are receiving reimbursement for one or two specific services. So I'll highlight, for an example, Nevada. Nevada pharmacists are able to be reimbursed for hormonal contraceptive and HIV PrEP or pre-exposure, post-exposure prophylaxis services, but it's limited to those specific services, which is why it's not represented here. But what we're seeing is a lot of states are focusing on either approaching commercial health insurance and passing legislation, or working collaboratively with commercial insurance to create contracts that allows for the reimbursement of pharmacist services. And you can see those highlighted here in purple. More recently, we are seeing more and more states actually focusing on Medicaid reimbursement. And we're seeing states that are introducing legislation that recognizes pharmacists as providers, requires that recognition and reimbursement of pharmacist patient care services. And we're seeing a lot of success in a handful of states in that. A few that I'll highlight here are Ohio and Colorado, where pharmacists are able to enroll and be credentialed as providers by state Medicaid departments. However, I will note that one of the variabilities that we're seeing state to state is how broad or narrow the services are that can be reimbursed. And one of the common themes that we're seeing is that pharmacists sometimes have to provide services within a collaborative practice agreement in order to receive reimbursement from a state Medicaid department. One difference that I'll throw in here is Wisconsin. They recently passed legislation that allows the reimbursement of services under Medicaid for any service within their scope of practice, which is just really, really exciting. They're still working through the fine-tuning the implementation of this, but it's really exciting to see such a progressive policy pass and actually go into effect here. But I feel like that's the broad scope of what we're seeing across the country.
It's very exciting. And one of the fun things about maps like that is getting to see how they change over time as we get to increase the colors. You talked about Wisconsin and the progressive nature of that particular state. And I know it's not ironed out yet, but are there any other examples from any other states that you would describe as progressive that you would like to highlight?
Oh yeah, so we are seeing so much progressiveness when it comes to pharmacist reimbursement, but oftentimes when we're talking about provider status, scope of practice also comes into the conversation. So I want to highlight some of the really incredible progressive things that we're seeing across the country when it comes to how pharmacists are practicing in addition to being able to be reimbursed for their services. One of the most progressive things that we've seen is pharmacists' ability to have independent prescriptive authority. One example of that is in Idaho, where for specific types of medications and disease states, pharmacists actually have that independent prescriptive authority, which is about as progressive as you can get from a scope of practice perspective. But we are also seeing a lot of really exciting opportunities for pharmacists to provide test and treat services for minor ailments, which is really aligned with the ECAPS bill that Elisa was mentioning. So we're seeing a lot of states that are focusing on allowing pharmacists to test and treat for minor ailments through statewide protocols. And once we're able to get ECAPS passed, it'll really open up the opportunities for pharmacists to be reimbursed under Medicare for those services that they're able to provide through their state scope of practice.
Very exciting, and my state is one of those. So we've been excited about the test and treat here in Florida. I wish I had a little applause button to hit for that, but it's really cool to see. So what about grassroots advocacy, Michael? Tell us about what's happening with grassroots advocacy at the state level, and talk a little bit about how our pharmacists and others who are watching today can help out with that.
Oh, yeah. So from my perspective, grassroots advocacy, pharmacists getting involved, reaching out to their elected leaders, that is the pivot point. You know, we can work with the state pharmacy association to help support them in getting legislation introduced. But if there's not people out there, you know, banging on doors, talking with their elected leaders, talking with the public about why these issues matter so much, it's really hard to move things forward. So pharmacists that are able to help to engage in dialogue with the public and with their elected leaders about these issues are so important. One state that I think has done this so well is New York. New York recently has been really focused on pharmacist issues related to pharmacy benefit managers, but also related to scope of practice expansion. And they frequently hold rallies with elected leaders where they'll go out in front of the state house and have signs talking about saving pharmacies and letting pharmacists practice aligned with their education. And the media comes out, people are posting about it on social media, and it just really engages people and helps to change the public perception of the pharmacist and helps the public understand that there's a big issue here that we need to focus and help to fix. So grassroots advocacy, reaching out to your elected leaders and talking about these issues and working with your state pharmacy associations as well as your national pharmacy associations are just so important to make sure that your elected leaders know about these issues and know why they are so important.
Thank you, Michael. That's great. And I love hearing you talk about the rallies too. I think that's one of the ways that students often get such a spark is because they attend those legislative days in pharmacy school, and you know, they're kind of never the same after that. So it's a good transition for us to go to Melissa and ask her about the ACT Collaborative and exactly what the work is of the ACT Collaborative.
Thank you, Teresa, and I couldn't agree more. I have it a little later in the slides, but you brought up how valuable it is for students to get engaged in advocacy efforts when they're students. And we see that over and over again. So for all of you that are out there, whether you're faculty, a practitioner, wherever you are and you go to do those advocacy efforts that Michael is talking about, take a student with you. They become inspired that they're real people at a state or a federal level, that they have something really valuable to share. The Academia CPSN Transformation Collaborative actually came out of a series of really interesting discussions amongst faculty. So I was asked by CPSN, it was back in 2018, and they were creating, as you know, Teresa, this massive change and connection of pharmacists, most of whom are in independent pharmacies, about transformation and supporting getting those contracts and advocacy efforts across the pharmacies. And we were doing the same thing here in Pennsylvania. And one of the key ways that we supported the development of our practice network here in Pennsylvania was the engagement of all 7 schools of pharmacy in the state. And interestingly, it came out of some of our advocacy efforts, because we were hearing from our state legislators, please come to us with one ask, and please say it all in the same way. Please don't have this, it's told this story one way, this story another way. We all have to get on the same page. And so we recognized if we wanted to transform what is happening in our state, that we needed to get everyone talking together so that we were saying the same things. We had the same goals, but we were all choosing different words to describe what those goals were. And so CPSN said, well, I bet there's other schools of pharmacy across the country that would like to get involved in these transformation efforts. And so as the faculty member that I am, I had to listen first before we developed anything. So we spent time at the AACP meeting and NCPA meetings in 2018 and really heard from faculty and also pharmacist owners about how critical they saw the need to connect the work that's happening in institutions, colleges, and schools of pharmacy across the country with these transformation efforts. And so we were fortunate to have a grant from the Community Pharmacy Foundation with support from CPESN as well as AACP to develop this collaborative with the sole purpose of transforming practice, but doing it in a way that's connected between academic units and colleges of pharmacy. We've been very fortunate. You can see that our collaborative partners that joined us in these efforts, NCPA, ACCP, and APHA. And we have a representative task force that includes practitioners as well as faculty who've been appointed by AACP to do a whole series of practice transformation efforts. And that's what I'll show you on the next slide. So in this slide, you'll see that CPSN USA, and this is representative. So when you think about transformation, we're giving you the example of how we're doing it in partnership with CPSN and national associations, but it's really true practice transformation efforts anywhere. None of these things are done in a silo. They all need to be done in a collective way. And so CPSN has been leading network development, payer engagements, quality assurance. Flip the Pharmacy, many of you may be familiar with these efforts. You can Google flipthepharmacy.com, but really focus on practice transformation at the pharmacy level. So helping teams at the pharmacy level support the day-to-day transformation. And we recognize that there needed to be a synergy with academia. So again, we were speaking the same language about what is happening with payers, what is happening then with transformation efforts. And on the next slide, you'll see that we chose to do this in a way that had 3 things. So we heard from faculty that we have to unite together. Many faculty who are doing community pharmacy practice transformation efforts often are an N of 1 and can feel a bit isolated from their colleagues. And some of that is because they're out in the pharmacies. So they're not always physically in the university building. And so the faculty were saying, get us together, in a way that we can support one another. And I think that's the same thing that we are hearing from pharmacists across our state as well. Our next goal was to mobilize. Let's do stuff together. Let's move together so that we're speaking the same language, and ultimately let's amplify the efforts by sharing and shouting out and shining the light on the work that's happening across the country, both in an academic environment and as well as in a practice environment. And so on the next slide is one advocacy example that we did in 2019, and we called it a National Day of Service. And it was a first dip into seeing what is it that we could do from an advocacy standpoint across these schools. And it was really incredible how quickly the faculty were able to get their students. And so, Teresa, when you talk about engaging students, engaging them in ways that they can see that they can be a voice and a transformation from the very beginning is incredibly inspiring, because they know they can do it again. And we see that over and over again. Now that we have committed to bringing, we bring our entire second year class to our state, but all 7 of our schools in Pennsylvania bring students to the state, then we see them come back as practitioners. And that's a really important part of this trajectory of making sure we always have a voice from an advocacy standpoint. So this National Day of Service that we did was about connecting the students out to go serve a pharmacy. So we had 34 schools of pharmacy that became involved, and you can see the data here with 223 students, 78 locations that represent 21 networks throughout the country. And on the next slide, you can see a quick snapshot of the number of patients that were served. And so our goal has really been to bring people together to speak with a voice and make sure that students are a part of these practice transformation efforts while they're right here in school.
Very cool. And I should have said at the top that I am a CPSN luminary, part of the CPSN network. I remember that first meeting, y'all coming together in North Carolina and wondering what you're all doing there, what was happening, not understanding it. I definitely remember the day of service and students going out, and I think it was in the fall, right? So a lot of them were helping with immunization efforts. So super exciting for you to share that. Thank you. So obviously, as throughout your career, Melissa, you've done a lot of advocacy, not just in this project, but this is so impactful. But do you want to talk to us just a little bit about some of the advocacy you've done, and maybe if you have any tips for our audience today about engaging in advocacy?
Absolutely, and I think we've all talked about how important these legislative day efforts are, and that's been a really important connection point for us across the state. I think the biggest thing for all of us to remember is you have a voice when you're present. And you can be present in a lot of different ways. You can become known to your state association by showing up. You can be known to your local legislators by showing up. But our biggest voice is by being present. And I encourage you to bring students with you. It is remarkable to me. And I mean this, if you're a practitioner, bring your intern. That was years ago. That was the first thing my preceptor, brought me to do this work years ago. And you'll hear that resonate, that same story resonate with a lot of students. But when you bring students, the legislators are very kind because they want to know, especially on the state level, they're really, are you going to stay in the state? How is your college going? Are you going to come back? Where do you want to work? And so it gives you this opportunity to have this very human dialogue with the legislators that opens I think a different type of environment as you then go to do your ask. And so we found it really meaningful, and it's fascinating when we can bring students from different schools together because there's always something to talk about there because of the diversity of where they're all coming from. The other thing that we've learned is the critical nature of bringing real life examples, and those examples being not only about patients, but how you are getting paid or how you are working with other healthcare providers. With the advocacy efforts we've recently done with vaccines, coming armed with letters from physicians who were supporting our efforts really changed the dialogue. And what was interesting is when these physicians working alongside our pharmacists, they're like, this is a no-brainer. We need to be doing more of this. Absolutely. Let me write this letter and share it. And that really did change the dialogue because it gave that pause if there was some level of opposition. And finally, I think it's an ongoing dialogue. My hope always was these things would happen fast as an advocate. They don't happen fast at all. And so a level of patience, but also a willingness to be a connector. And so you might not be able to have evidence on every single advocacy issue that comes forward, but you can be a connector. You often will know if someone locally in your community is doing these efforts. So if you're talking about vaccines, that might be a lot of people, but if you're talking about a collaborative practice agreement or a particular therapeutic area, being a referral source for your state association, for the national association, and an encourager for your colleagues to also use their voice and sharing their experience can really make a big impact. And we try to share those things with the students. We make sure that when they come, they share their own experience to really reinforce the value that their voice has. And every practitioner is the same thing. What you do day to day really does matter because the legislators only see what they've personally experienced. So your voice matters in the advocacy efforts.
Thank you. Such great tips. And I really like the last one because I think sometimes that we think that the legislators understand issues or that they really are experts, and they're not. They want to hear from you. So that's great. All of it was great. Thank you so much for that. All right. So one more question for you, Melissa. There's a cool project that ACT is doing called 50 Stories in 50 States, and I want to make sure you have time to touch on that. And then after that, we're going to go to Q&A for the whole group from the audience or comments. So go ahead.
Thank you, Teresa. Yeah, this is a fun project. So it came out of a dialogue with our AG task force saying we want to tell these stories and we want to make sure that they're told throughout the country. So one of the things that is often heard in advocacy, that's great that it happens in another state, but how about mine? And we certainly hear that a lot in Pennsylvania. And so we wanted to be able to, again, engage students, trying to highlight on those practices that are doing innovative work and doing it in a way that's comprehensive across the country. And so we have initiated this challenge. We actually have 45 states. We're going to be releasing all of it actually at the end of July as a part of the AACP meeting. We need 5 more states, so I'm going to put that in the chat. So if any of you are out there in 5 states that we need, we want to hear from you. And that's Delaware, Montana, Nevada, New Hampshire, and South Dakota. But we do actually have more than 50 stories. And what these are, the challenge was to partner a student and a faculty member with an innovative practice in their state. And to be able to tell the story of the services that are being provided, and it includes an opportunity to do a short video, photographs. And so what this end outcome will be is you'll be able to, we're going to have highlight 3 of them in the beginning, and then you'll be able to click on the different states and you're going to find an innovative practice. What's really remarkable was that they're all different. And that's really special. You're going to be able to see really that diversity of what's happening across the country, and really those community-based connections that are something that we have as pharmacists that other health professionals don't have that access. They walk in our doors and we have these relationships with them. And I think you're going to feel that when you see that. So our hope is that, again, we're using these relationships between students and faculty and practices to shine the light on what's happening and to provide tools that allow the advocacy efforts to happen nationwide.
Sounds really neat. So it's a sneak peek. So can you tell us how it will be released and where we can watch for it at the end of July?
Absolutely. So we're going to release it in person at the AACP meeting, the American Association of Colleges of Pharmacy meeting. And then you're going to see press releases and a big social media blitz after that. But it will be on the actforpharmacy.com website with connections to the national associations. So definitely take a sneak peek. And I'm hoping I can put this in here so that you can see. And then there are another series of resources that are developed and are all available on the actforpharmacy.com website. Of particular interest for those of you that are in practice is likely the patient casebook. These are all patient cases that have actually happened. They're de-identified, of course, but have happened in community practices that can be really useful to students while they're on rotation with you. We have a series of Pharmacy Times articles that have come out recently about partnerships between community pharmacies and academic institutions. And we're going to have another framework coming out to support faculty in teaching community pharmacy practice transformation to really show we're all in this together. So thank you, Teresa.
All right, thank you so much. Okay, so I'm just going to remind the audience that we really would love your feedback. We'd love for you to share some thoughts today, maybe some of your own advocacy efforts, or if you have any questions for the panelists. So I do have a couple that have been queued up, and I'm going to get to those now. So Elisa, I gave you one already, and I think we've touched on it in a lot. So, but why is it important? Hopefully we've heard that, but why is it important to for all of pharmacy to engage in these advocacy efforts?
Sorry. Why is it important? Because yes. This is our profession. This is what we've been trained for, to provide patient care services, and we want to be able to use those. And why is it important for everybody to get involved? Because as you've seen, this is coast to coast, up and down. You know, there are some states that have more scope than others, and it's those states that are the role models that you can use that information and you can use those experiences when you go to your state. And some of these, I'm very excited for your project, Melissa, to actually see some of those examples and see how they can be used as tangible efforts in advocacy efforts in other states too, in order to get that. And so We need that grassroots effort at the state level, but at the federal level, in order to get legislation passed, your legislators want to know that this is something that they can do for you, so that you will then go and turn and vote for them the next time they're up for election. So, part of this, the other thing that is yes, you can go visit them at the Hill, or in their office in the state, but invite them to your pharmacy, invite them to your practice setting, let them see exactly what you do, so that it's not just their touch point when they see their local pharmacist. So that's important, because they can get that different perspective. And the more that we're all behind this and our patients are behind it, the more that can drive the Congress to pass this legislation.
Thank you, Elisa. I saw another question for you as well. There was a question about a Senate companion for ECAPS. So can you provide any commentary on where we are on getting a Senate companion bill for that?
Yeah, so I did mention it was only introduced in the House. There is interest in the Senate, though the Senate wants to know that this authority is needed, and they want to make sure that it's needed, and have asked CMS to provide them information that demonstrates that this is needed, and that pharmacists can't provide these services without this authority. So a letter was written from Congress to CMS, specifically asking the question of whether this authority is needed. We as a coalition, APhA and others, we actually just met with CMS last week to explain to them specifically why it's needed, what are the challenges, what are the barriers that we've been seeing during the pandemic, because we need to make sure that those challenges and barriers are overcome with this legislation. And so we wanted to give those examples. So right now the process is waiting to hear back. I think the Senate is waiting to hear from CMS. But in the meantime, that doesn't mean that we can't continue in our own efforts, and you all and across the country, of contacting your senator and telling your senator and in the House, your representative, why this is needed and why it's so important.
All right, thank you very much for that. So I know that a few of you have added some examples to Michael's map. I know that Michael knew that it was not all inclusive, but a couple of notes that I made were that Idaho has commercial and Medicaid payment for services. Illinois has DSME and DPP services. So Michael, I don't know if you want to speak to that briefly, but you knew that there was no way you'd capture everything, and things are changing so dynamically. In fact, I saw a tweet from you yesterday that was hilarious. Oklahoma kind of quietly did this, so I don't know if you want to speak to that or not, but lots of things happening very quickly.
Yeah, and I really appreciate that feedback, and truly not intended to be a comprehensive representation. It's very challenging because things are moving so quickly. And Oklahoma, we recently saw a piece of legislation was signed into law on May 26th that recognizes pharmacists as essential community providers within their state Medicaid program, and also allows for reimbursement of services that they're providing at an amount no less than another healthcare professional. So huge win for Oklahoma. I was just talking with them yesterday, and I know that they're currently in the process of meeting with the Medicaid department to work through implementation, but very, very exciting to see all of these advancements continue to happen so quickly.
And Michael, correct me if I'm wrong, but that was almost like something that was quiet, right? You weren't even it wasn't even really on your radar in Oklahoma, is that correct?
Yeah, so that is one of the interesting things that really happens at the state level, is there can sometimes be a little bit of a different strategy. And, you know, sometimes things can kind of fly under the radar in order to not ruffle too many feathers and to actually sneak something through, get pharmacist provider status without seeing too much opposition. So we were really excited to see that move forward.
That's great, and it's cool to hear about the strategies. It's hard to understand how all of these things happen. So you just talked about opposition. So I have a question for you and Elisa that has come in. What are some of the biggest challenges we're seeing at both the state and the federal level with other healthcare providers buying in? And Michael, since you were talking, let's just finish with you at the state levels, what you've seen, and then we'll go to Elisa for that one.
Yeah, so I think that's a really important question to address and something that we can prepare for when that question inevitably will come up. So frequently, we are seeing medical societies that will come out in opposition to legislation that expands pharmacist state scope of practice, and oftentimes as well aligned with reimbursement for pharmacist services. Now, I do want to throw in a caveat there that we have, after having specific dialogue with medical societies and helping them to understand if a bill simply focuses on reimbursement, we are seeing some medical societies actually come out neutral and in very rare circumstances actually supportive of legislation. And the reason for that is because I think for many physicians, they may already have a pharmacist embedded in their clinic, and they see if pharmacists are not able to bill for their services, that has a direct revenue impact on their clinic. And if pharmacists can bill at a level that is commensurate with what they can actually provide and the valuable care that they're providing, that can have a pretty dramatic impact on the revenue generation of that pharmacist. So scope of practice expansion, that will likely continue to be a challenge to ensure that pharmacists are providing their services, but providing the explanation to physicians and medical societies. But it is very encouraging to see neutrality or, in rare circumstances, support for payment for services.
All right, Michael, thank you so much for that. Okay, Elisa, let's talk about what's happening at the federal level with other healthcare professionals that are buying in with us, and then maybe some opposition.
Well, I think Michael described the issues and the challenges with the medical community perfectly. So ditto when it comes to the medical community at the federal level. But at the same time, getting other healthcare professionals on board with us is just as important. And so we have gotten a lot of other associations of other medical professionals signed on and specifically stating their support. We've also, part of this is also showing the demand from patients. And so there are a number of healthcare professional, or not healthcare, for patient organizations that have signed on in support. And when I say signed on, what does that mean? That means that as part of that coalition, we have recruited and gotten other organizations to say, we support this. Tell Congress, you can use our name, you can use our logo. And so we've included those in letters to Congress to demonstrate the support generally from the different patient communities. So yeah, so it's getting that support from all around, not just from other healthcare professionals, but from the patients as well.
All right, great. And can organizations still sign on?
Absolutely, yes. Yes, if you are a part, if you are an organization, whether a pharmacy organization, I assume most of the people here are from state pharmacy associations, other, you can sign on, you can either come to APhA, contact me, contact Michael. We will get you in touch with the right way and the right process on how to sign on and let your voice be heard.
All right, great. Thanks, Elisa. Okay, so we have about 5 more minutes left for questions. I do have a couple of questions for you, Melissa, and then I have a comment after that. So, Melissa, is the ACT Collaborative also encouraging academic institutions to work with their state pharmacy associations to have one voice?
Absolutely, and I think it's a great question, and that was part of the one of the initiatives to really talk about legislative day, and we pulled the data together from across the country, and many academic institutions are already working for legislative day, and it's this encouragement to actually go beyond that and work cohesively with the state associations. It's interesting because the academic institutions can also help foster the growth of the state associations and vice versa. So there can really be a really important dynamic that happens between the state association and the schools. And we've certainly seen that here in Pennsylvania. Once we were able to get all the schools together with our state association, we really did see a growth and actually more of a depth of what the state association was able to do because they had more folks as resources, including students as a part of that.
Great. And then there's a question specifically for you, Melissa, about an example of a testimony you've provided in Pennsylvania, if you can think of one, and then kind of navigating some of that political process. So, I mean, you talked earlier about bringing patient letters, which I thought was great, but can you think of something else to share?
I certainly can. And there was another comment too about working with the state board. And one of the things I really want to encourage you all to think about, every state is unique, which is fascinating, right? And so here in our state, there's been 2 ways that we've been able to advocate. While the state board will work certainly alongside of us, we've actually had a lot of success in working directly with our Secretary of Health. And so that has been really interesting, particularly during COVID. Early on, we had the law passed that our students could vaccinate, but the regulations hadn't passed. They'd been sitting dormant and waiting for quite a few years. And so that was something that needed to change very quickly. And we, as 7 schools, got together and advocated actually directly to our Secretary of Health through a series of letters. And it was really interesting how quickly and responsive the secretary was, because they were hearing evidence. So we provided, as an academic institution, we do everything with evidence and science. And so we provided them evidence. And when they see that, signed off by the deans of 7 different schools, it carries, I think, a really important message with it. So that's been one interesting way we've advocated. We did the same with regard to the point of care testing. It was the same thing, providing the evidence, providing what was going on throughout the country, providing the support. So that has been important to us. And then most recently, as we've been looking to keep the waivers, so many of you likely have had some waivers that have expanded your scope of practice in your state. The same was true for us. And so we brought a panel of pharmacists from different practice environments to our state House of Representatives to testify in October. And that's one of my learning points, that nothing happens fast. So we testified and they really enjoyed our testimony because it was very friendly and evidence-based. And so that's something I really encourage you all to think about. Always bring the evidence, and that evidence is both the data and stories. Both are really important, and do it in a really collegial way. The testimony was only supposed to last probably about 15 minutes. They stayed 45 minutes after the session to continue the dialogue with us, and have invited us back to the state capitol 2 additional times, and then some phone calls to really work out the nuances. And I really deeply believe it's because we've brought a diversity of speakers from across our state who are bringing different perspectives. So hospital, community, academia, our associations, and we did it in a really collegial way. And so I think that there's a lot of different ways to advocate, but data, stories, and collegiality really seem to hit the mark that allow us to propel our work in the state.
All right, well, that will be our last question. Thank you for kind of wrapping the last question and comment into one. That was perfect. So thank you all for your participation today, and just a great discussion. At this time, I'll have you turn your cameras off, and I'll just do the wrap-up slides, but great to have you with us. All right, so we're just going to go through a few things that are happening at APHA. So we have on our webpage, on our website, opportunities for you to get involved. So I think you've heard today that provider status needs you. So this is a very easy way for you to contact your representatives and tell them that we need their support. So if you visit our website, you will see under the Take Action Now tab, or you can just click there and easily either schedule an appointment, or you can send a note to your legislator just by putting in your zip code. So we definitely encourage you to do that. We have many practice resources that are available. The website is available there on our website, but the link is there. So you can go on and learn more, even state by state, as you can see, where you can download some fact sheets. So we just encourage you to visit those pages as well. And we definitely want you to read our journal, Pharmacy Today. So it is available online right now, and it should be coming to your mailboxes soon. But we have an article that was written, co-authored by Elisa Bernstein and Michael Murphy on how to accomplish provider status and have pharmacists get paid for our services. So definitely be on the lookout for that. And just thank Elisa and Michael for penning that article. And our members get every 2 weeks the latest advocacy update, the legislative and regulatory update newsletter that has all things APHA and all things advocacy, everything APHA is doing. Our government affairs team is amazing. You only got to see a couple of members of them today, but there's so much that they do. So this is a great newsletter, and we encourage you to read it each week. And we do not have continuing education for the webinar today, but we do have education that is available that you can access, including a home study and that does a deep dive into the concepts you need to know, and a quiz that you can take to test your knowledge. These programs are free to our members, and anyone in our audience who isn't a member, you can access them for a fee. If you're not a member, I encourage you to become one to save on the cost of the continuing education, and plus to gain access to all of these other great resources that we've talked about today. Hopefully this has encouraged you to do that. And finally, as we mentioned, this webinar is going to be on the second Tuesday every month. So, sorry. I mean Thursday. So next month, July 14th from 12 to 1, and our topic is going to be on medication errors, specifically in light of a recent case in Tennessee that occurred when a nurse was found criminally negligent for making a medication error. We will explore the implications of this for pharmacists and for pharmacy teams. So we hope that you'll come back again to join us on July 14th. And finally, today's webinar recording will be made available as soon as possible in our Open Forum series library, which you can access at the link on your screen. And with that, we will conclude this webinar for today. Thank you so much for being here, and we wish you a blessed day.